Okay, everyone, we might make a start. Welcome to the Food Literacy Symposium. My name's Helen Vidgen, and it's really exciting to have so many people here and 50 sites eventually that have registered to be online. So it's really interesting and exciting to think that so many people are interested in this topic. So I hope, while I'm confident that we can really deliver for you a really interesting and engaging presentation. So the really brief housekeeping things are that the bathrooms are just if you keep heading this way along the aisle corridor, and there are in the case of an emergency, there is a stairwell just behind the lifts and various assembly points in the grassed areas. So I just wanted to start by acknowledging the traditional owners on the land on that which we're meeting today, and acknowledge the leaders past, present and emerging, and that these have always been places for learning. I think particularly over the years that I've been involved in food literacy, it's been really interesting to consider what that looks like from various different cultural contexts and the different beliefs and assumptions that we bring into that. And learnings from Aboriginal and Torres Strait Islander people are very central to that, and looking forward to that being a greater part of the work we do in this area. So I wanted to start a little bit. I'm known to a lot of you in the audience, so I thought I would give you a bit of background into how I came into this area. So I started working in the area of food literacy in 2009. I worked in corporate office of Queensland Health in the preventative health unit, where we were asked to do some work in the area of food literacy because it had come out as a area in Eat Well Queensland that we wanted to do more work in. Kevin Rudd was the Prime Minister at the time. Anna Bligh had just come into power as the state's first female Premier. We had a Health Minister, Paul Lucas, who'd recently separated from his wife and wanted to learn more about cooking. So had his ministerial staff wanting to know more about that. We had Eat Well Queensland, which had been the state's first public health nutrition plan, and it was at the midpoint, and people were saying they wanted to know more about food literacy, and that term hadn't existed when we wrote the plan. I was in a policy officer role. We were writing briefs like this. I pulled out some files from 2009 to see what I was writing about. Just for those of you who've been in nutrition for a while, take your mind back to those sort of policy areas. Jamie Oliver Ministry of Food was beginning to be, they were looking for funders in Australia. Stephanie Alexander Kitchen Garden Program, we were preparing briefs for the Department of Education on whether or not they should invest in that area and which areas they should invest in. And it was the first year of MasterChef. And so everybody was starting to talk about that and the way in which it was engaging people in cooking more. My daughter had youngest had just started grade 1, and Danielle Galagos was looking like this. This was happening all over the world, and that's been the really phenomenally interesting part to me as my research journey has continued here. We had Michelle Obama changing the White House garden to a kitchen garden. This sort of terminology was being used in the Decade of Action on Nutrition. It was in the obesity management plans of the UK, and it was becoming the way we ate was described in the dietary guidelines of Brazil. France was UNESCO heritage listing its way of eating. So this was a phenomena that was happening all over the world, possibly in response to a real transition in the way that we eat, the way we go about acquiring food, our food supply in general, and people being not really sure about what the implications of that might be on our health, and I guess some more broader implications. So it was in that environment that my PhD set out to look at developing a measure of food literacy originally, but it went back in the first stages of just thinking about a definition and a common language. And I guess coming from a policy environment in corporate office, I was really aware of the importance of everybody having the same language about something, so that then we can move forward on knowing whether or not when we're intervening, we're being effective. And so I guess that's a theme of a lot of the presentations today. So I talked to a range of different food experts and then young people about what they thought you needed to know and understand about food to use it to meet your needs. And this was the definition that we came up with at the end of the thesis. It's a scaffolding that empowers individuals, households, communities or nations to protect diet quality through change and strengthen dietary resilience over time. It's a collection of interrelated knowledge, skills and behaviours required to plan, manage, select, prepare and eat food to meet needs and determine intake. We also understood that it was really contextual, because we looked at young people across a spectrum of disadvantage, from homelessness to university graduates. And the nature of each of the components of food literacy and their relative importance to each other were very contextually dependent. And this really has then kind of stumped us a bit in terms of measurement. But I wanted to quickly talk you through the definition and the components that we came up with, and then we'll talk about where the work's gone from there. So my thesis identified these 4 domains of food literacy and then several components within each domain. So in the planning and management domain, it's about prioritising time and money for food, planning your food intake so you can keep, I guess, some sense of diet quality through change, whether that's a small change or a large change, and then being able to make feasible food decisions. So you know enough about, for example, how long purchasing some food might take you, so that you can pull a meal together or feed yourself in a range of different resource contexts. In the selection side of things, there's a component around understanding your food supply, so knowing that you can access food from multiple sources and the advantages and disadvantages of these, and then being able to determine what's in a food product. So not explicitly knowing about food labelling, but that's where that sort of stuff fits in. But then also knowing how to store it, how to use it, and how to judge the quality of food, whatever quality might mean for you. In the preparation domain, this was a little bit different to what we might have particularly thought of as nutritionists. Originally, we started with this: what dishes do people need to know how to do, what techniques do people know, what ingredients, but really people were motivated to prepare food if they had enough of a repertoire of skills, they knew how to use had work within the limitations of what was around them, so that, and do it well enough that it provided a good enough alternative to something that they might purchase as fast food or something like that, and then an element of food hygiene. And in the last component, which we called eating, there were some parts about nutrition that you didn't need to know exactly RDIs or anything like that, but just a general sense of what you needed more or less of. Nutritionists didn't particularly rate this as a high element, but young people, when they conceptualised someone who was good with food, they included somebody who was not just good at really preparing food or could do a great souffle, but also had an element of the health impacts of the food that they were eating. And then the last component there around the social dimensions of food and eating, which isn't particularly well measured in existing measures of food literacy, but is something that when people are talking about why they're investing in this area, they usually mean an element of that component as well. So then I came up with this model that said that it's unlikely that investing just in food literacy is automatically going to result in an improvement in dietary intake, but it's going to improve the predictability of your food intake. It's going to improve the range of choices that might be available to you and the pleasure that you might get from eating core foods. My thesis was very focused on nutrition outcomes because that's the paradigm I was coming from, but this model also kind of acknowledges that there's a lot of other reasons that people invest in food literacy, and that's definitely become a big focus area when you look at the literature more recently, such as food security, environmental sustainability, and social connectedness. These relationships I think this is where I was trying to really communicate that a skill people's food insecurity or their dietary intakes, not simply a deficit of skills, that this exists within the social determinants of health and broader food environments that will limit the extent to which that relationship can be strong. So for example, you know, there's some great quotes from my original research where people are homeless and living under a bridge, exceptional food literacy, in terms of quite astounding what they're doing with very limited resources, but there's a limit on how much that's going to improve their health. This is just, this diagram hasn't been revisited for a while. It came out at the beginning of my thesis as well, really kind of to position it in public health nutrition policy and to acknowledge that it would not be able to be a standalone strategy. And I think increasingly with governments, investing in food literacy is quite politically an attractive thing to do, but that it needs to be done in the context of a range of other strategies, and it's unlikely to be a magic bullet in any of this. So I guess what's happened since then is so 2014, the paper was published, and then I was invited to write a book, which for people who are, that's a collection, I guess, of key researchers and authors at the time. It came out in 2016 that are looking at its application in health or its application in education, what might be some of the complexities and the interfaces with health literacy, that kind of thing. Then in 2017, Italy and the Netherlands both developed a measure for food literacy, and both using my framework to underpin their measure. And we started a collaboration with them, and we also started the process of an item pool of questions for a measure. We found that we thought we were pretty similar, but actually the items were quite different. And so that's a piece of work that Courtney Thompson, who you would have had a bit to do with in registering for this workshop, his PhD is going to be furthering that area. And Margie's here to talk more about the Dutch measure, and Jean is co-supervising Courtney, so can talk a bit about where we're coming from in terms of things we might want to consider with measurement. The definition, though, has been really widely used around the world, and this has been really amazing to me as someone who started on this journey as thinking it would be something that would help answer some policy questions in Queensland. And I think that's really interesting to reflect on why that is and what's the relationship with the globalisation of the food supply and some of the different challenges that we face in nutrition. The United Nations Food and Agriculture Organisation have now decided it is the outcome of school food and nutrition initiatives for the Decade of Action on Nutrition. And it's being used really widely from countries as diverse as Lebanon to Canada and the US, and in some parts of Southeast Asia. So I think that's just an interesting thing to ponder. Why are all these countries having this thinking at the same time? Canadians are doing a lot of work in this space, and you might remember that earlier this year the Canadian Dietary Guidelines have talked a little bit about how people go about feeding themselves as well. So at the beginning of this year we published a narrative review on existing measures as a starting point for measurement. We've focused on the measurement in adults, but the measurement among children is another whole huge area in itself. So we're starting the process of item pooling and looking at that, and doing some research next year around the extent to which this definition is relevant for children. In our conversations with the Italians and the Dutch, they both use this health literacy model from the European Union. It's useful to think about because it talks about what does health literacy look like beyond the individual. And I think that's our challenge now. We're thinking a little bit, if we're talking about food literacy, it's easy to think about it as development of skills and knowledge in an individual, but what does it look like when you're thinking about it more broadly? We've had a bit of a go at maybe trying to look at what questions might look like if we're using this is a continuum that they use to come up with the questions and the conceptualizations for health literacy in the EU. So we've had a bit of a we're trying to have a bit of a think about what does this look like when you're looking at food literacy for a household or a nation. And then the conversations have moved to what's the role of nutrition workforce in enhancing food literacy at those different levels. And that's where Penny's discussion is going to take us a bit more this afternoon. Recently, I know Margie and I in particular have had some conversations about these diagrams that are part of the Lancet Global Syndemic on Climate Change and Obesity. And this particular diagram that looks at the individual and the individual not just existing in their household, but as being an actor and a player at various parts of their lives. And then thinking about is food literacy the set of knowledge, skills and behaviours that lets you move, I guess, as an advocate for core foods across those various dimensions. So I think I'm just going to talk a little bit about that too. But we're hoping today, we're really excited about having such a great range of really experienced practitioners in the room. So we're hoping that we can really stimulate your thinking in a range of different areas that I know that we're still wrestling with, and to kind of collectively get your thoughts on what you think about these spaces.